Hi, my name is Janicia Ford, and I'm a psychiatrist at the Veterans Affairs Hospital in Dallas. I work with veterans who have been sent back to the States. I deal with wounded veterans, veterans that are trying to transition back into civilian life, or even veterans or just any veterans that have been in active duty combat. Most of the veterans that I deal with on a daily basis are dealing with post-traumatic stress disorder following these life-threatening events. Most of them have reactions that don't go away once they return, or they may even get worse as time goes on. Most people that suffer from PTSD often suffer from nightmares, flashbacks, difficulty sleeping, and may just feel emotionally numb. There are 4 types of PTSD symptoms: reliving the event, which may be nightmares, flashbacks, or even triggers like being in a large crowd at certain times. They may avoid the situations that remind them of the events. They have negative changes in beliefs and feelings and hyperarousal. Depending on the severity of PTSD, I try psychotherapy with some of my veteran patients, or sometimes medications, or sometimes even a combination of both of the two. I find that it's a process of guess and check, seeing which one works well with them and what they respond better to. I like to try different types of psychology therapies, such as family therapy, group therapy, psychodynamic therapy, before we start adding medications to their body. With the more severe patients, I have tried to evoke potential studies to see what triggers their PTSD, anxiety, or other underlying disorders. We show them different pictures and sounds to see how their senses will react to the different stimuli. With those patients, we also try antidepressants and preferably SSRIs, and also anti-anxiety drugs to try and kind of help provide an effective drug therapy. Again, that is for the more severe cases of PTSD. Most of these veterans have an underlying drug addiction which they use to cope with their PTSD, depression, sleep problems, impairment of their ability to function in social or family settings, and other physical and mental illnesses. One of my patients is an African American woman. She's 33 years old with 2 beautiful girls and a handsome husband. She grew up in a loving middle class family who supported her. She is pretty much healthy besides the fact of dealing with systolic hypertension. She served 2 tours in Iraq, and on her last tour, she watched her convoy get blown to pieces by the enemy while she was coming back with supplies. Her best friend's body parts were scattered all around the bomb site. Half of her sergeant's fate was blown off. As she was coming to help him, he told her to go find the radio. She said she vividly remembered seeing all the muscles and the bones in his face moving as he was talking to her. She said the worst part was, at that moment, she felt like she just wanted to die with them. But she knew that wasn't possible because she had a family to get back to at home. She was fine for the most part of her returning, until she went to Paris, where they had the bombs go off. Where she had the bombs go off. They were celebrating her and her husband were celebrating their 10-year anniversary. He was really worried about her after that. She basically didn't recover after that. So after a few incidents, they decided that it was best to check her into the VA and see if she can get better there. So recently we've been having one-on-one talk sessions and things like that, and luckily we have been making a breakthrough with her, and now she's starting to grow to group therapy and talk about her feelings. Also, now she's able to even just go outside and enjoy the fresh air with her family when they come to visit her. PTSD in soldiers is a very realistic issue. Some of their stories and the things that they're trying to hide and escape for are just very troubling, and it's very touching stories. With these soldiers, you have to be patient with them. Give them time to get to know you and to trust you, and to finally be like, okay, I am ready to talk about what's going on. This is not something that's it may take a couple of minutes, and then this may be a process where it takes months for y'all to establish that relationship. With most of these PTSD patients, medication is not always what they need. Sometimes just sitting down and talking to them and just getting to know them about their life, what they've experienced, the things they've accomplished, that really makes a huge difference with most of these patients. PTSD is a very serious and a real situation. There are so many people out there who are dealing with PTSD on a daily basis, and we may not ever know about it until they have that traumatic breakdown. But this is a very real disorder that we need to be more aware of and be more conscientious of. These people, they need our help, and once they get it, it makes a huge difference.